Recording in progress.
Afternoon, everyone. My name is Sharon Bogan. I'm here with Public Health Seattle and King County. It's nice to have you all here to join us to talk about the COVID-19 pandemic. And we'll get started right away. We have Dr. Jeff Duchin with us today to give us an update. And it's been a few weeks, so we're glad to be here with you all today to provide some more information about the state of the pandemic, what we know about boosters, and a few other topics. So with that, we'll turn it right over to you, Dr. Duchin.
Well, thank you, Sharon, and thank you everyone for joining us today. I'm glad we're able to get back together. It's been a few weeks. There's been a lot that's happened, and today I'll try and summarize where we are with the outbreak. We'll talk a little bit about where we are with our vaccination program, the new vaccine verification program. We'll speak about COVID in youth, the booster dose recommendations, and finally, a bit about the recent tragic death associated with J&J vaccine and try and put that into context. So let me begin with the epidemiology. As of yesterday in King County, we're reporting 155,000 cases, 8,142 hospitalizations, and 1,913 deaths from COVID-19 during this pandemic. I'm encouraged by the fact that although COVID-19 transmission remains high, the Delta-driven summer surge in COVID-19 cases, hospitalizations, and deaths has been trending down since mid-September. Over the last 7 days, we've seen an average of 445 cases per day, representing a decrease of about 8% from last week. The 7-day incidence rate is currently 144 per 100,000, still high level, but representing a gradual descent of 26% from our summer peak of 199 per 100,000 on August 11th. And rates are falling in all age groups. Our incidence rates remain the highest among young people and young adults, youth and young adults, and regionally are highest in South and Southeast King County. The vast majority of our COVID-19 cases, hospitalizations, and deaths continue to be among people who are unvaccinated. In the past 30 days, 66% of cases, 78% of hospitalizations, and 79% of deaths are among people who are not vaccinated. Our hospitalization rates have fallen in all ages from their summertime peaks. Over the past 7 days, 98 King County residents were hospitalized for COVID-19. That's one person hospitalized every hour and 40 minutes. And that's down 10% from last week. There were 23 20 to 39-year-olds hospitalized and 21 70-year-olds and older hospitalized. Although the rate of hospitalization is 4 times higher for the 70-year-old group, we're seeing an increasing proportion of hospitalizations among younger adults. Just over half of our hospitalizations were in the 40 to 69-year-old age group. Now, hospitals throughout the county and the region continue to experience stress from very high patient volumes and high acuity cases with longer patient stays. However, overall COVID hospitalizations are declining, and that's helping. Currently, there are 192 hospitalized confirmed COVID-19 patients in King County healthcare facilities, and that's down 40% from the recent peak of 320 on September 9th. Compared to earlier in the pandemic, a larger proportion of recent hospitalizations are in younger adults, as I've mentioned. In the last 2 weeks, nearly 35% of those hospitalized for COVID-19 were 25 to 49 years old. Now, COVID-19 hospitalization rates remain much less common for children and youth, with only 4 hospitalizations in the 0 to 17-year-old age group over the past 2 weeks. And hospitalization is even more rare among children who are vaccinated. We're averaging 3 deaths per day currently, or a death every 8 hours, and that's down from a peak of 5 deaths per day in early September. A greater proportion of these deaths are again among younger age groups compared to the pandemic overall. Over the last month, 13% of deaths are in people 35 to 49 years of age compared to 3.6% overall during the pandemic. And 47% of COVID deaths have been among people aged 35 to 64 years recently, compared with 19% in that age group during the pandemic overall. COVID-19 vaccines continue to provide high-level protection against hospitalization and death, but you need to get vaccinated for them to work. The risk of getting COVID-19 and being hospitalized and dying due to COVID-19 are much higher for those who are not fully vaccinated. For example, 66% of cases, 78% of hospitalizations, and 79% of deaths are among people who are not fully vaccinated. And these differences between fully vaccinated and not fully vaccinated are even more stark when we account for the differences in age. After we adjust for age, people who are not fully vaccinated are 8 times more likely to test positive for COVID-19, 46 times more likely to be hospitalized for COVID-19, and 78 times more likely to die due to COVID-19 related illness. Now, I want to speak a bit about how we're doing on the vaccination front, because I think our King County residents and healthcare providers and our community members need to be proud. In King County, 81% of people ages 12 and older are now fully vaccinated against COVID-19, and 87% of those 12 and older have received at least 1 dose. 70% of all King County residents have now completed the vaccine series, and these rates should provide substantial protection from severe future surges. So thank you to everyone who's been vaccinated to protect themselves, their family, their coworkers, and their community, to our many vaccine delivery, healthcare system, and community partners, and to our public health staff for helping us achieve this accomplishment. At the same time, we have approximately 566,000 King County residents, over 500,000 not fully vaccinated. This includes about 250,000 eligible adults not yet started, and 110,000 adults who have started but are not yet complete in their series, as well as 308,000 ineligible children. Now, approximately 180,000 of those may become eligible because they're in the 5 to 11 range, and the vaccine is going to be considered for approval or authorization in this age group late this month or early in November. So because of this, we're continuing to work to ensure access to vaccination. And over the past few months, our staff helped facilitate COVID-19 vaccination clinics at schools for eligible children and their families. And we're including a number of events that also provide flu shots and other immunization needed for school. And we've got at least 40 other community-based events scheduled for October. Now, in addition to continuing to provide access to vaccine, King County's vaccine verification policy is one of the ways that public spaces are going to be safer for everyone as we move into the fall and winter months. Starting on October 25th, our vaccine verification policy takes effect. And this means that indoor service at bars, restaurants, and other indoor recreational facilities like theaters and gyms, as well as large outdoor events with 500 or more people, will require proof of vaccination for anyone 12 years and older. Anyone who's unvaccinated or does not have verification of their vaccination status must show proof of a negative COVID-19 test. Now, the King County vaccination verification requirement builds on the vaccination verification policies that many restaurants, professional sports teams, universities, and businesses already have in place. And our goal is to reduce the spread of COVID-19 in high-risk public settings, to reduce COVID-19 cases, hospitalizations, and deaths, to help take pressure off the healthcare system and return patient loads to more manageable and sustainable levels. Also, by reducing the risk of COVID-19 spread in the community, we decrease the risk to our children. And this is especially important until vaccine is available for those from 5 to 12 years of age, which we hope will happen early in November. You can check our website where we have details about what can be used to verify vaccine and other frequently used questions about the verification program. I want to speak a little bit about COVID-19 rates and youth. I want to update you because I know this has been of particular interest since the reopening of our in-person schooling. Now, through July and August, COVID-19 cases increased for all age groups, adults and children, with the arrival and rapid spread of the Delta variant. Since in-person school began in late October, we have not seen an increase in case rates among youth. Recently, case rates have decreased among all age groups, but the decrease in youth has been slower compared to the decrease in adults. For example, from August 31st through October 1st, the COVID-19 rate among youth up to 17 years dropped 16%, while among adults 18 to 64, it dropped 32%. And there are some differences within the youth age groups. Since late August, COVID-19 rates have dropped 32% in the youngest children, 0 to 4 years of age, 21% for 16 and 17-year-olds, and 7% for 5 to 11-year-olds, while the rates have remained relatively stable in the 12 to 15-year-old group. Now, we don't know whether these differences might be related to increasing protection from vaccine in the older children and adults, or the role of prior infection in some age groups, or from changing behaviors, or differences in transmission risk related to in-person schooling or other activities among youth. So we will continue to monitor these trends and look for sustained increases or divergence from rates in adults that might indicate increasing transmission risk among school-aged youth compared to adults. Now, currently, 70% of eligible youth 12 to 17 years of age in King County are fully vaccinated. And that's a fantastic statistic. However, youth vaccination rates vary across the county, with higher rates in the 80s and up in much of our Seattle and North King County geography, and rates in the mid-40s to 60% in South and Southeast King County. Improving youth vaccination rates across the county is important because in the past 30 days, youth who are not fully vaccinated were 8 times more likely to test positive for COVID-19 and 15 times more likely to be hospitalized for COVID-19. So increasing vaccination coverage among currently eligible students and among children 5 to 11 years of age as soon as a vaccine is available for them will be the most important, but not the only necessary strategy for the prevention of COVID-19 among children. Schools will need to continue to use a combination of measures, including vaccination, improving ventilation and the use of filtration, face masks, testing, and keeping ill students out of school and other strategies. Now let me transition to talking about the boosters. This is exciting news as well. As you've heard, booster doses of Pfizer COVID-19 vaccine are now recommended and available for the following groups of people who received the Pfizer vaccine and had their second dose 6 months or longer ago. So these are people 65 years of age and older, residents 18 years of age and older who live in long-term care facilities, and people 50 to 64 years of age who are at high risk because of underlying medical conditions. We're asking everyone in these groups to get a booster dose now if it's been 6 months or more since your last dose. And I'm asking our healthcare providers to reach out to recommend the booster dose and where possible, provide it to those patients who are eligible. Older adults remain at highest risk for death from COVID-19, and the booster dose will help prevent serious outcomes and provide longer lasting protection for this group. Now, this recommendation was made after reviewing evidence that protection against infection and hospitalization decreases over time in adults 65 and older. Among younger adults, vaccine remains effective against hospitalization and severe disease, but protection against less severe infections decreases over time. For this reason, several other groups of people who previously received the Pfizer vaccine may get a booster if desired. And this includes people aged 14 to 49 years who are at high risk because of underlying medical conditions, and people 18 to 64 years who work in settings that put them at high risk for COVID-19, particularly healthcare workers and people in correctional and institutional settings. Now, again, these boosters are currently only available for those who receive the Pfizer vaccine, and people should get the vaccine booster 6 months after their second shot. The FDA will be considering data on whether boosters are needed for people who received the Moderna and J&J vaccines next week. And the ACIP will make recommendations based on what the FDA authorizes for these vaccines. Booster doses currently are free and available at Public Health's Kent, Auburn, downtown Seattle, and Bellevue Eastgate vaccination clinics. as well as at our many partnership clinics throughout King County. Visit kingcounty.gov/vaccine to see a list of vaccination sites. Drop-in booster vaccinations are available without appointments. In addition, many local pharmacies and healthcare clinics are providing booster shots. Now, before I take questions, I want to address the recent heartbreaking news of the death of an adult King County resident in her mid-30s from a rare blood clotting disorder called thrombosis with thrombocytopenia syndrome, or TTS, after receiving the Johnson & Johnson vaccine. First, I want to extend deep sympathy and condolences from myself and our public health colleagues to the family and loved ones of this young woman. This tragic death is very unsettling. I know it was for me when I heard about it, and it must be for people who are currently making decisions about vaccination for themselves and their families. So I want to try and put this information into context to help others understand the risk and make informed decisions about their choice of vaccine. As of September 29th, more than 14.9 million doses of the J&J vaccine have been given in the United States. The CDC and the FDA have identified 47 confirmed reports of people who got the J&J COVID-19 vaccine and later developed TTS. And the CDC has reported 3 other confirmed deaths from this syndrome associated with the J&J vaccine. TTS is a very rare complication, but even though rare, the risk for TTS is not the same for all, and it's highest for women 18 to 49 years of age. It's important to know that the increased risk from TTS has not been associated with the Pfizer or Moderna mRNA vaccines or in men. Now, against this risk, we need to understand and balance the benefits of vaccination. In King County to date, there have been 1,913 COVID-19 deaths, including 32 COVID-19 deaths among women 18 to 49 years of age, and 96 deaths among all people 20 to 49 years of age. In the US to date, over 700,000 people have died from COVID-19, and 10,872 of these deaths were people between 30 and 39 years of age. The CDC analyzed the risks and benefits of receiving versus not receiving the Johnson & Johnson COVID-19 vaccine during a 1-month period after the COVID-19 Johnson & Johnson vaccine pause. They found that for every million doses of the Johnson & Johnson COVID-19 vaccine administered to women 18 to 49 years, the highest risk group, 7 TTS cases would be expected, 7 per million, while the vaccinations would prevent 297 hospitalizations, 56 ICU admissions, and 6 deaths related to COVID-19. So let me say that again. For every million doses of the J&J vaccine administered to the high-risk group, women 18 to 49 years, in 1 month, 7 TTS cases would be expected, while the vaccinations would prevent 297 hospitalizations, 56 intensive care unit admissions, and 6 deaths related to COVID-19. In addition, the benefits of the vaccine are likely to increase over time as the risk of TTS decreases after the 1-month period. Given this large number of hospitalizations, ICU admissions, and deaths prevented through vaccination, compared with the small number of TTS cases, although severe, FDA and ACIP concluded the benefits of the J&J vaccine outweighed the risks. But the ACIP also emphasized the importance of providing education for vaccination providers and the public about the risk for TTS and the availability of other COVID-19 vaccine options, particularly for women aged 18 to 49 years. In other words, when considering what vaccine to get, women aged 18 to 49 in particular should know about the rare but possible risk of TTS from the J&J vaccine and know that other vaccines are available that do not carry that risk. Finally, I'm going to have a word about pregnancy and COVID-19. This has been in the news lately, and it's another tragic situation. Pregnant people and recently pregnant people are being shown to be at an increased risk for severe illness from COVID-19. This includes increased risk for intensive care unit admission, the need for mechanical ventilation, and ventilatory support such as ECMO, extracorporeal membrane oxygenation, to get oxygen into the body, as well as increased risk of death. Pregnant people with COVID-19 are also at increased risk for preterm birth and might be at increased risk for other poor pregnancy outcomes. For this reason, COVID-19 vaccination is recommended for all people 12 years and older, including people who are pregnant, breastfeeding, trying to get pregnant now, or might become pregnant in the future. The American College of Obstetricians and Gynecologists, our leading national professional organization that cares for women who are pregnant and for women's health problems, states that there is no evidence of adverse maternal or fetal effects from vaccinating pregnant individuals with COVID-19 vaccine, and a growing body of data demonstrate the safety of such use. Vaccination may occur in any trimester, and emphasis should be on vaccine receipt as soon as possible to maximize maternal and fetal health. If you're pregnant and have questions about COVID-19, you can talk with your healthcare provider. And if you'd like to speak to someone about COVID-19 vaccination during pregnancy or about pregnancy, you can contact Mother to Baby. Mother to Baby experts can answer questions in English or Spanish by phone or chat. This is a free and confidential service. It's available Monday through Friday, 8 a.m. to 5 p.m. local time. And you can reach Mother to Baby by calling 1-866-626-6847. You can also Google Mother to Baby and find the information on how to engage in a chat. So with this, I'd like to pause and welcome your questions.
Thank you so much, Dr. Duchin. And for those who'd like some more information about pregnancy, on our FAQ on our website, we have some information to address both breastfeeding and pregnancy. And we also have a series of slides that'll be posted on our resources page later today with some additional information. So thank you for that, Dr. Duchin. Now we'll go to questions from media. Let's start with Jessamine McIntyre, and if you can share the name of your media outlet, that would be great. And others, you can use the raise your hand function. So you are unmuted.
Thank you, Jessamine McIntyre with Fox 13. Appreciate your time very much. I wanted to talk to you a little bit about capacity, that we're obviously seeing issues all over the region in the state. And we're hearing about these elective surgeries, elective procedures, which are more accurately defined as not emergency procedures. But, you know, I have heard from pregnant women who have had birth inducements be delayed. I've heard from mothers who have tried to bring a 6-year-old with a broken wrist in to get care, and they can't because they're not at an immediate threat of death. What is it like in King County right now, and what can we do to make it better?
Thank you, Jessamine. I think that, first of all, I encourage you also to speak with our King County hospital leadership, with our Northwest Healthcare Response Network leadership, who have the most up-to-date information about what's happening in our King County hospitals. But I am in close contact with those people and those organizations. And I can tell you that the healthcare system in King County remains stressed, but the situation is improving because the number of COVID-19 cases has been declining. Now, the cases that are in the hospital are quite ill, and they stay in there for quite a long time. So it doesn't free up hospital bed availability, or particularly staff availability or resource availability immediately. That takes a while longer. And our hospitals have expressed their appreciation to the people of King County for taking any and all steps to protect themselves from developing COVID-19 and needing hospitalization. They very much want to be able to be there to care for not only COVID-19 related complications, but for all the other things that you were mentioning, Jessamine, that need to be addressed when people get sick, have accidents, and develop chronic illnesses. And we know that many people defer their care when the hospitals are in surge capacity status and very stressed, and they don't come in. And that deferred care also leads to more advanced disease and more serious illnesses when the hospital's capacity frees up or patients feel more comfortable seeking care. So we really continue to encourage people not to put off going to your healthcare provider or seeking healthcare if you've got a problem that you think you need help for, because delay sometimes is very difficult and makes things worse and harder to treat in the future. So what I can tell you is that our King County healthcare facilities are seeing improvements in the number of COVID cases, but their overall census remains very high. They are able to care for an increasing number of non-COVID cases as the COVID case load diminishes, but we really do need to continue to make sure that the COVID case load continues to drop. And in King County, we still have a high level of transmission based on case rates, but our vaccination level is helping us significantly in keeping many people who would otherwise need to be hospitalized out of the hospital. So continuing to vaccinate as many people as possible and getting these booster doses into the older adults and those people with underlying health conditions will be critical, because again, if the protection from the vaccine wanes, people will be more vulnerable to serious illnesses. And we want to get that long-lasting high-level protection in those high-risk groups to keep them healthy and also to keep them out of the hospitals. So I hope that answers your question to some degree. That's probably the best I can do. And I think for more details, talking with the Hospital Association or some of our regional experts at the hospitals themselves would probably be best.
Just a really quick follow-up. Sorry, doctor, and sorry for everyone waiting. What would you recommend people do if they are in an emergency situation that isn't necessarily life-threatening?
Absolutely seek consultation or get care. If you're in an emergency situation, you need someone to help you assess your illness, your symptoms, and understand whether you need to be seen or not. So don't try and manage it yourself. Call your healthcare provider. If you don't have a healthcare provider, you need to seek healthcare if you're worried about something like being an emergency or you've got another health condition that you think you ordinarily would see a healthcare provider for, but are feeling inhibited against. Don't feel inhibited. Please go and see that healthcare provider.
Thank you very much, Jessamine, for that important follow-up. Appreciate it. While others are working on raising their hand, we have some questions from the community. One question is going back to your comments about boosters, Dr. Duchin, and one of our community members is asking, what about people who are living in congregate settings, like college students in dorms? Is there an option for boosters, or will there be an option for boosters if wanted for them at some point?
The data that we've seen so far from all the vaccines suggests that protection remains very high in young people. The information that led to the booster dose recommendation really was based on waning protection against serious infections in older adults. That said, there is a decrease over time, and we're talking about the Pfizer vaccine now. There is a decrease over time in infection in younger people, but those infections are not the more severe variety. The risk is greatest in those who have underlying health conditions and who are living in certain congregate settings. So for that reason, those groups were included as people either who should get a booster if they're 50 to 64 years of age or in a long-term care facility, or 65 years and older, or can consider getting a booster if they're younger and at high risk of medical conditions, or have high-risk medical conditions, 14 to 49 with high-risk medical conditions, or they work in settings where they're at high risk. At this point, and we're continuing to learn and make recommendations as we get more information, and as time goes on, we may see things change. But at this point, otherwise, young, healthy people do not appear to need a booster.
Thank you. We'll take a question from Joey Thompson. Go ahead.
Hi, Joey Thompson with the Puget Sound Business Journal. Thanks for taking the question. Can you explain a little bit, has there been much outreach with businesses ahead of this vaccine verification? I know a lot are concerned they're going to be dealing with angry customers, ways for de-escalation and any other updates on what business owners should expect come October 25th.
Yeah, thank you. Those are important questions. The department did extensive outreach, and the King County Executive Office did outreach with community stakeholders, including businesses and community groups. And we're continuing to try and, initially we heard their feedback and tried to understand some of their concerns and tried to incorporate that information into our policy to the greatest extent possible. And we're continuing to try and meet the needs of business owners and being successful in implementing these policies. I don't know exactly how much is up on the website right now. I guess we'd have to get back to you about what resources we have available on the website, but I know we do have teams in place who are available to assist business owners. And we'll post an email address where business owners can contact the department and get assistance or ask questions and get help if they're having issues around implementation or questions about the guidance.
And one quick follow-up, if that's okay. Sure. One of the complaints from retail and hospitality folks is that they feel, targeted, and that, them and gyms are really the businesses that are being affected by this, whereas a grocery store or a retail shop wouldn't be. Could you explain, the decision-making process there? And is that something we could expect possibly in the future?
Yeah, so the decision-making really is based on risk. And, our policy is very similar to those that have been implemented in other parts of the world, in Europe and Canada, British Columbia, multiple other cities around the US. And it's based on the fact that certain activities in certain settings present a higher risk for COVID-19 spread. This virus spreads through the air. It's exhaled into the air and it floats around like cigarette smoke or perfume would. So the places where people spend a longer time, like a restaurant or a gym, or places where people do activities like exercise or singing or other things that would put more of the virus into the air, pose the greatest risk. And that's why these particular venues are selected. In addition, large congregate settings where super spreader events can happen are included. So we understand that this isn't perfect. It doesn't stop all transmission, and that there are venues in the community, like you mentioned, retail, grocery stores, and so on, where people typically spend much less time, which are larger and some of them very well ventilated spaces where the people need to visit for essential services, that it didn't make sense for this, both on the risk basis or on the basis of allowing people to continue to do what's essential for them. So this is really focused on trying to identify venues that present the highest risk and that are not essential.
Thank you. And we put in the chat that for those who are interested, you can, for more information for businesses about the verification policy and resources, you can go to kcvaxverified.com, and there's lots of information there. As well, the Seattle Metropolitan Chamber of Commerce is conducting outreach and providing a lot of information for businesses throughout the region. So that's another resource for folks. Thank you. Let's take a question from Kate Walters. You can go ahead.
Thanks so much for taking the time, Dr. Duchin. Kate Walters with KUOW Public Radio. Just wondering if you could take a second to talk a little bit about how you would characterize where we are in the pandemic at this point. We saw that really vicious Delta surge over the summer that seems to be declining now in terms of case rates and hospitalizations. But I think the question on everyone's mind is, when will the next shoe drop? What will things look like in the coming months?
Kate, thank you. Can I ask a favor of you? Can I make your question the last question I answer? Because I do cover that in my closing statement, and I'd be happy to take a follow-up from you after that, if you're able to hang on for that.
No problem. Appreciate it.
Awesome. Thank you.
Great. Thank you. I wanted to go back to another question from the community about what we're seeing as far as what we call breakthrough cases. And one of the questions from our community is, why are we still focused on number of cases and reporting number of cases when we know that people who are fully vaccinated can transmit COVID-19? So if you could characterize again a little bit more about transmission of folks who are fully vaccinated, and the community member put in caveat that they are fully vaccinated.
Great. Well, thank you. I especially appreciate questions from fully vaccinated questioners. So so cases are one measure of what's happening with respect to transmission in the community. Hospitalizations and deaths are other measures. And I think as we get deeper into this pandemic and beyond, as this virus continues to circulate over the years, we'll pay attention to what's more meaningful. And as over time, I think we'll find that tracking hospitalizations and deaths is probably going to be more useful to us. I think we're probably getting to that phase currently. However, with respect to cases, it's important because, as you say, vaccinated people can transmit COVID-19. And that's one of the reasons we recommend in some settings, high-risk settings, even vaccinated people wear masks. However, you have to remember that vaccinated people are at much lower risk of getting infected in the first place. So, and if you don't get infected, you can't transmit. So by that logic, you're less likely to transmit whether you're vaccinated, if you're vaccinated, because you can't be infected as readily. And secondly, if you are infected, if you're one of those rare cases of vaccinated person who becomes infected and becomes symptomatic, you're more likely to have a shorter duration of contagiousness. In other words, the likelihood that you'll spread to others is lower than someone who is unvaccinated. So it's true when people say vaccinated people can spread COVID, that can happen. And we've had cases here in King County where we've had outbreaks where vaccinated people have been infected. However, the likelihood that a vaccinated person is going to become infected and spread COVID is much lower than the likelihood that someone who's unvaccinated will become infected and spread COVID. And if you become infected and you're vaccinated, your likelihood of spreading it is much less than if you're unvaccinated.
That was helpful, thank you. And we'll do one more question here from the community who's asking about, we're at that time of year where we're getting into the holiday season, and Halloween is coming up. Last year we had some guidance. Any thoughts this year from you, Dr. Duchin, as folks are starting to prepare for Halloween in a few weeks?
Preparing for Halloween.
Yes.
Yeah. I think that folks should feel comfortable about outdoor Halloween activities, certainly. Particularly trick-or-treating, I think, is going to be safe for children outdoors in small groups, particularly family groups or people that they're otherwise socializing with. If there's any concern, face masks can be worn under face masks. I think that masks are always going to add a layer of protection, but in small groups outdoors, the risk is relatively low to start with. With respect to indoor gatherings, I think the same guidance is appropriate as would be for any indoor gathering. Mixed gatherings with vaccinated, unvaccinated people are risky. The larger the gathering, the riskier, and ventilation is critical. This virus will build up in the air of indoor spaces over time, and if there's not good ventilation and air flow through that space, there will be risk to people breathing that air, particularly if they're unvaccinated. So we do recommend that if you're going to be in an indoor public space with others, masking is important to add protection. Ventilation is critically important. And if you're gathering with friends and family, I think you can have much more comfort if you're vaccinated, and masks would not be necessary if everyone's vaccinated with friends and family. But again, it's those mixed environments with people who may not be vaccinated in public spaces where ventilation might not be optimal that the most caution is warranted.
Thank you. And let's go back to your question, Kate Walters, where we were asking just we think maybe ahead. So Dr. Duchin, if you want to say your concluding remarks.
Yeah, thanks, Kate, for reading my mind. I continue to be cautiously optimistic about the course of the COVID-19 outbreak, but let me break that down for you a little bit, the caution and the optimism. On the optimistic front, our overall COVID vaccination rates are relatively high, which is great, and our highest risk adults are especially well vaccinated. Vaccination is our most important protection against future large surges, and current vaccines are effective against the widespread Delta variant. So that's all reason for optimism. Booster doses can improve the protection we get from vaccines, and a vaccine for school-age children is on the horizon. So these will further protect our community. And cases and hospitalizations are still substantial, but heading down. Schools back in session, we have not seen a spike in cases among youth. And we're continuing to get vaccinated and wear masks to protect ourselves and others. We're doing more things. We've not needed to go back to restrictions on activities. And those are all reasons for optimism, in my view. On the other hand, there are reasons for caution. We still have a high level of transmission in cases regionally, and our hospitals remain stressed. It's too soon to tell how successful we will be ultimately with in-person learning throughout the fall and winter. Ongoing vigilance and sustained effort will be needed to keep transmission down and risk down, both in schools and in the community, particularly as the weather cools. And this is the big one. COVID-19 remains unpredictable. So far, around the world, it's come in waves every few months, and winter is a relatively high-risk time because of the indoor gatherings and the lack of the same quality and volume of airflow that we have with open windows in the spring and summer. So I expect future waves, and I expect a winter surge. Although given our vaccination rates, the size and impact of future surges should be lower than in the past, although they could be substantial if enough people remain or become susceptible. There are currently about 250,000 eligible unvaccinated people and 308 ineligible children in the county, and that's enough dry wood, so to speak, to sustain a serious surge. So we can't predict with certainty how the virus will evolve with respect to virulence or evasion of immunity from current vaccines. Those are additional unknowns. But the bottom line for me is that the big picture COVID-19 pandemic forecast is improving, primarily thanks to the vaccines. But the pandemic is not going to end quickly, and it's not necessarily going to end predictably, but gradually. I think we may be entering a transition phase, moving away from large damaging surges such as we've experienced, and towards a time when we'll still need to grapple with this virus, but we can manage the threat more effectively, primarily with vaccines. But also we'll need some ongoing behavioral and environmental changes like masking in high-risk settings, improved indoor air with attention to ventilation and filtration, widely available testing, and medications. So I think the next few months will provide a better indicator of our trajectory, but that's my best assessment of where we are now.
Great, thank you.
Kate, I'll offer you a follow-up before we conclude.
Thank you, Dr. Duchin. I got everything I needed. Appreciate it.
Okay. Well, with that, then, I'd like to thank everyone for joining us. It's a pleasure to be with you again, and I look forward to talking to you soon.
Thank you all for joining us. Have a great afternoon.